going to be recording the entire conference, so don't worry about that. So yes, welcome again to our PAPHC 2022 conference. Let's give a round of applause for that, y'all. Our theme for today is the new public health, right? Because we are still in the COVID pandemic, my apologies. But of course, we're still here to rise together. So next slide, please. I am your conference MC for today. My name is Christian John, or CJ for short. My pronouns are he, him. I'm also part of the logistics committee as a volunteer lead as well too. Currently, I am a graduating senior from San José State University, pursuing a Bachelor of Science in Public Health with the concentration of community health education and a minor in Asian American Studies. Woo! So of course, you can see the QR link down there on the corner. That QR link will go straight to our social medias, of course. You can follow on our social medias at PAPHC 2022 as well. So moving on to the next slide. I'll be giving out our welcoming remarks for this mic. So then I'll be passing on to Ate Jen and Kamille.
Good morning and/or good afternoon, everyone. Welcome to the Pilipinx-American Public Health Conference, the new public health. Jen and I are super happy and grateful that y'all are here today with us. If it is your first time, welcome. I hope you enjoy our conference. And if you are a returner, I hope you also enjoy our conference and, are excited for all the new content and workshops that are coming up in the next few hours. I'd like to introduce myself. My name is Kamille Magante. I go by she, her, shop pronouns, and I am the co-founder and the co-director of PAPHC. And then Jen, or Jennifer Cayanan, she is my co-founder and the co-director for this conference, and she goes by she, her, and shop pronouns. Thank you again, and CJ, go ahead.
All right, now I'll be moving on to our itinerary to today. So for our itinerary today, this is our schedule of events. So at 10 to 10:15, of course, we'll be doing our opening or at Pacific Standard Time. Then moving forward at 10:20 to 10:50, we'll be moving forward to our keynote speaker, so be ready for that. Then at 10:55 to 11:40 a.m. Pacific Standard Time, of course, as well too. That's going to be at our workshop block number 1. So our workshop block number 1 is, drumroll please, professionalism. So, yeah, that'll be great to have. Then after that, we'll be moving forward into our long break, or kind of like an afternoon break, at 11:45 to 12:45 p.m. Then after our break, we'll be coming back all together here at this main room for our guest panel. Our guest panel will be 12:30 to 1:50 p.m. Pacific Standard Time. And then moving forward to our workshop block number 2. This one will be, again, drum roll please, based on health disparities. Super fun, super great, and something that we should all be talking about. After our workshop block number 2, we'll be going into our closing remarks at 2:45 to 2:50 p.m. And this will be, of course, optional, but straight into our networking sessions from 3 to 4 p.m. as well too. Down below, of course, will be the Eastern Standard Time as well too. Go ahead and take a picture of this, or screenshot, of course, since we're virtually on this setting. And yeah, give y'all some time just to take a picture. All right, perfect. I think everyone took a screenshot, right? Nice. So now you can move on forward, and we'll now be talking our partner organization, PAWIS. So then I'll be passing the mic on to, kind of have another drum roll, please, Hannah and Mac. Hannah and Mac, are you in the chat?
Yes, hello, everybody.
All right, yeah, go ahead and take the stage.
All right, we're going to be doing a quick little elevator pitch for PAWIS, or the Filipino Association of Workers and Immigrants that is based here in San Jose area or Santa Clara County area. We really wanted to highlight PAWIS and the importance of organizing specifically caregivers, not just any Filipino health workers. This is mainly due to the fact that, we know that there's a lot of Filipino health workers in hospitals as nurses, and even doctors, which is great. But we really want to talk about the fact of caregivers, right? And the specific exploitation that caregivers experience. So the main purpose of these caregivers, and they typically work at homes and in really isolated settings, is economic. They're here to make money. They're here to send remittances back home. And that's their primary reason for being here, right? And so because of the conditions of the workplace, they have a really specific kind of exploitation and isolation that they experience. And so I'm going to pass it off to Hannah to talk about that and even a case study.
Yeah, so some of the most common struggles Filipino workers face include wage theft, right? Harassment that is gender-based, and of course, harassment based on their immigration status. Intimidation from their landlords, even their peers, is also a common way that those who have more means to an end can ridicule them for their financial status. And with the culture shock, right, workers are forced to isolate. With that, their mental health tends to come last because most of the time their situations are dire, right? They're here so that they can tend to their families back home through remittances. And most of the time, they're the only ones in their families who are able to find a job. COVID brought on more struggles, as you can imagine. Their physical health, mental, and emotional health were all on the line these past few years. In our organization alone, one member and her husband have had to sleep in their car after leaving the care home she worked at due to wage theft, but they had nowhere to go. And so it was in the beginning of winter, in the middle of the pandemic, and her husband became homeless. They lived in their car for about 2 months. And she reached out to a friend at one point to see if they could let them stay in their apartment, but they ultimately declined due to COVID. And so caregivers most of the time, right, are similar to contract workers where the term no work, no pay is coined. And in her own words, because I was out of work, we don't have money. And most of the time I earned as a caregiver, most of the money I earned as a caregiver was sent back home to my children because they're going through even more hardships than I am in the Philippines in the time of the pandemic, especially my sister who took care of my kids in the Cayman Islands. She got incredibly sick at the start of the pandemic and passed away. Obviously, this was a really unfortunate situation, right? And luckily, this person was able to be connected to PAWIS initially, where she received rental assistance, an employment lawyer to aid her for wage theft claims, and most importantly, a community she can rely on through these tough times.
Yeah, so as Hannah said beforehand, with that case study,
Hey, Natalie, how are you?
Okay, how are you?
Okay.
I'm okay, thank you. Calling you just about your the list that I'm working on.
Oh, yeah.
Oh, okay, for sure. So this case study that Hannah mentioned beforehand really highlights the importance of organizing with PAWIS. So we're really grateful for y'all's support. What PAWIS does is provide material support, such as helping pay for rent and medical costs. We also provide a community for caregivers in the area and provide emotional support by affirming them through their struggles, because a lot of them feel isolated and alone working as caregivers. Furthermore, we provide legal guidance and know your rights trainings. We also provide a political framework to their conditions through educational discussions like Philippine Society and Revolution, which I all recommend you taking, and labor export policy. And this really gives them an idea as to why they are here as caregivers and what does it really mean to be exploited, but also what does it mean to take that power back and really understand yourself as a worker in the area and how you contribute to society. So that being said, thank you so much this conference, for organizing alongside PAWIS. This is a really important grassroots organization that is locally based, that is really helping and improving the lives and welfare of caregivers in our area.
Thank you.
No, thank you. Y'all are doing such a great work in ensuring that, we have all health aspects in life and ensuring that everyone is, continuing to grow within our community. So give me 1 second. So yeah, if you want to learn more about PAWIS, of course, their website's down below. It's in the chat as well too. Their website's going to be PAWIS. I believe that is a -sv.com. So moving on to the next slide. We'll now be moving on to our Indigenous land acknowledgement. So one of our volunteers has come up to say this, so I'll be passing this mic to our volunteer, Joshua.
Good morning, everyone. Before we start the conference, I want us to start our time together with an acknowledgement. We gather here today, digitally and physically, due to the First Peoples, Indigenous peoples, and original stewards of the lands of Kuya, Tonga, Keech, Kumyai, Ohlone, Miwok, and Kohowai Pai'aina. If I have left out any original stewards or mispronounced anything, I welcome you to correct me. Although myself and others like me have the privilege to settle in a house or apartment due to settler colonialism and imperialism, we must shift our complacency of their forced removal and genocide to active allyship and solidarity with Indigenous peoples to decenter and dismantle capitalism, imperialism, and colonialism. Since 2020, the impact of the ongoing COVID-19 pandemic has emphasized the importance of our work as public health and soon to be public health experts. Let's ensure we are using our knowledge and skills to advocate and build with communities neglected and displaced by the United States government to improve and heal the health of this land and its people. I would like to ask you all to take a moment of silence as we ask the stewards of the land to use their land for our conference today, as well as reassure them that our education will benefit them as well.
Okay, thank you so much, Joshua. Now moving forward, we have our keynote speaker. So now introducing our keynote speaker. Our keynote speaker is Kamille Yamamoto. Kamille Yamamoto is a founding member of the Kapo Health Collective and, an affiliated organization of the National Alliance for Filipino Concerns, or NAFCON for short. They strive to respond for the health needs of San Francisco Filipinx community through collaboration, education, and collective action. Kamille's work is influenced by their family's experience in Hawaii as migrant workers, as well as Filipino grassroots movements in the Philippines and the US. Now introducing Kamille.
Hi, everybody. I'm just going to go ahead and share my screen. Cool. CJ, I think you're the first person I see. Can you give me a thumbs up if my audio is okay?
Yeah, it's going good.
Awesome.
You see your screen as well too.
Awesome, awesome. Thank you. All right, great. Yeah, I can go ahead and get started. Thank you all for giving me the time and space to share a little bit about my own personal journey. I want to thank the Pilipinx-American Public Health Conference Planning Group for inviting me to be this year's keynote speaker. I was honestly really shocked when I first got the email, not only because this is the first time that I've ever been asked to do something like this, but also because I've never really seen myself as fitting into the mold of what it means to be a public health professional. So again, my name is Kamille Yamamoto. Like it's already been mentioned, I'm a founding member of Kapwa Health Collective, an affiliate org of NAFCON, who strives to respond to the health needs of the San Francisco Filipinx community through collaboration, education, and collective action. Starting next month, I'll be working at San Francisco State. Go Gators, if there's any folks in the audience. And I'll be working in undergrad student development. So I think, you might be thinking it's not a typical public health job, but I'm still able to support students who are starting their own journey into community work, which centers on the well-being of the community. And I'm sure, like we all know, public health doesn't exist in a bubble or a vacuum. It needs to be embedded in the actual material conditions of the communities that we work with. So my keynote today is titled A New Outlook on Health, which is named after James Boggs' pamphlet with the same title. I highly recommend this as a reading for any aspiring health professionals and community health organizers, as community organizing isn't just this evidence-based health promoting intervention. It's actually health equity in practice, or it's praxis. So before I kind of get into where I am now, I wanted to share a little bit more about who I am and how I got here. I grew up in a small town on the island of Oahu called Wahiawa. If there's any folks from Hawaii, love to connect with you all. So you'll see a little pinpoint. That's where Wahiawa is. And for those who might know a little bit about Hawaii's history of plantation work, that's actually how my family got their start in the US. So growing up in a working class neighborhood and attending school in the busiest city in the state was probably one of the first experiences that I had of social inequity that I can remember. And from a young age, I was faced with the contradiction that some people could afford a comfortable life while people like my own family had to make sacrifices to make ends meet. My mom, pictured there, she went straight into trade school, and my dad, also there, had to drop out of college because he couldn't afford to continue. So obviously, right, because of the struggles that I witnessed them go through, I always thought that education was going to be my way out. That was the way I was going to, leave the island, make a life for myself, all those things. And in high school, I made up my mind that I was going to get my PhD. So I set up my life with the trajectory to do so. I finished undergrad in 3 years with my degree in cultural anthropology and my minor in sociology. I presented my original work at several academic conferences. I volunteered and interned. I was a Fulbright Scholar semifinalist. All the things you can think of really to boost my resume and to be competitive. And then in the summer of 2019, I decided to accept an offer to move from Seattle, since that's where I did my undergrad, to the Bay Area to start a MPH program at SF State. And I sought out the medical mission with the National Alliance for Filipino Concerns to gain some hands-on community health experience before I started my program. So you can ask anyone who was on the medical mission with me, and I'm not sure if anybody here attended with me in the summer of 2019. And they'll tell you that I had a really hard time, not because of the experience of going to the Philippines for the first time, but really out of all the things that I had experienced in my life up until that point, the medical mission was the most challenging because it made me really confront who I was doing this work for and why. I studied my community and their health, both physical and mental, because I wanted to prove a point that the topics that I was interested in, my lived experiences, all these things were just as important as all the other things I read books about and articles about. And then I went to the Philippines and I realized that my 15-page papers didn't do anything for the people that I wrote about. Going to a country where being poor is a crime, where corruption in the government is rampant but overlooked, and bombs and military force is more available than doctors and nurses, all these things made me uncomfortable. These are things that I heard about but never witnessed for myself. And it made me really grapple with why my family and so many other families leave the Philippines every day. So despite the conditions that people in the Philippines face every day, something that I was only really able to witness in the 2 weeks that I was there, what struck me most was their ability to collectivize their struggles with one another and organize for solutions. After the medical mission in Manila, where we went to communities in Tondo, I also attended a extension in Samar in the Eastern Visayas region. And this is where, that's where this picture was taken. I heard firsthand communities members' experiences and their struggles, barangay captains, like the man in the green polo on the left side of the picture. Barangay captains like him were being killed for advocating for their community, and occupying military forces were threatening and harassing farmers, accusing them of supporting the New People's Army because they're just fighting for their rights and their livelihood. One ate, who's actually holding her baby in this photo, she shared that, her baby was sick. She traveled to Tacloban City, which is about 2 to 3 hours away by moped, to see a doctor for her baby. And when she arrived, the doctor didn't even bother to look at her baby, just prescribed her Pedialyte and sent her back on her way. What I learned was that for peasants in the countryside, who make up the majority of the country's population, the solution to support their basic needs is really genuine land reform, because it gives the land back to the people who actually till it, instead of the landlords who exploit their labor for profit. And grassroots organizations like the ones I met and build relationships with, they don't just swoop in and hope to save the people or remedy the repercussions of an unjust society. They encourage people like the ones I met to really understand their conditions, to analyze their conditions, and assert their rights. So despite a constant climate of fear, the community members that I met during my time in the Philippines really showed me what genuine people power looks like. Community organizing isn't just an act of rebelling against an unjust society. It's a way for people to raise their collective consciousness and decisively address their suffering. My trip made me realize that, the things that I learned in the classroom and what I wrote and researched about, all those things, it wasn't enough. Theory needs to be combined with practice, and really without practice, the theory that we read and study and write about doesn't mean anything. So after those 2 weeks, I came back to the US, holding on to a lot of emotions like guilt and sadness and anger. It was really tough transition, living, really simply like that in the Philippines, and then coming back to the US where you're surrounded by so many different distractions. When I was still in the Philippines and I asked what I could do after I returned to the States, people just asked me to continue carrying on their stories. And I think when they told me that, I was like, really? That's like all I can do is just share your stories? And I was really grappling with like, what did this all mean to me, and what was kind of the internal strife? What was that, and like, what do I do with that? And soon after I returned from the Philippines, I packed up all my belongings in Seattle and I drove down to Bay Area. And when I got here, I think a month or so into when I was kind of settled in, I read on social media that some organizers in the Philippines were red tagged or blacklisted and labeled as terrorists because they're critical of the actions of the government. Maybe some folks have heard about red tagging, and I think especially with the anti-terror law that was recently passed, things like that may justify red tagging. So these organizers in the Philippines, they're red tagged and arrested. And then I saw their pictures on, I think it was Facebook or Twitter or whatever it was. And I realized that I met these folks in the Philippines just 2 months prior to where I was in that moment. Like I said, it was a very new feeling for me. It's weird to think that people that I met by total circumstance and people who really contributed to transforming and broadening my knowledge of community work, they had their offices raided and were illegally arrested, saying that they were planning all these things, illegal firearms, whatever it was. But I know from the time that I met them, we ate, we talked story, we played games on the beach. They weren't like that. And the picture you see here was actually the first mobilization that I ever attended, much less spoke at. And I was really scared. My voice was shaking. I've never, I think for folks who know me, they might think that I'm this like really outspoken and direct person, but the person I wasn't in this picture, I wasn't like that at the time. And I never ever saw myself as somebody who could do that. But it wasn't just my own fire that, encouraged me to speak that day. It was the fire and rage of the people that I met in the Philippines, as well as the people that I met here locally that I carried with me. And this experience and my time in the Philippines, I held all these things really closely throughout my time in school. And because of this, I never really had a clear direction for what I wanted to do after I finished. I knew that I was interested in community health and education from my prior experience as a teacher, as a worker, but I didn't know what I wanted to do with my degree. And I kind of felt like I was just going through the motions. While many of my classmates' master's theses were about food security, infectious diseases, and child and maternal health, mine was a political analysis of the Philippine government's militaristic response to the COVID-19 pandemic. And my thesis was informed by my experience in the Philippines and the grassroots organizing that I'm currently involved in. So I gave you kind of a short synopsis of my politicization and how I got to where I am today. But what do I actually want to convey to you all in this keynote speech, especially as we're in the context of the COVID-19 pandemic? I'm sure by now we've all attended countless webinars and read many articles about how the pandemic has further exposed the rotten roots of this capitalist system. And to many of us, this isn't a surprise. We know that when we think critically about institutions and other structural barriers, or for us public health folks look upstream, we will see that these systems were never created with communities like our own in mind. So it's no wonder that we're in the state that we're in now. So with all the missteps that we've seen in the past 3 years and over the course of our own personal lives, what does it mean to confront the culture of capitalism, and how does the current public health system enforce it or reinforce it? How do you explain the rich becoming richer during a global pandemic, while the majority of the people, like the workers that, the folks from PAWIS talked about, folks like that, everyday people, they continue to struggle. Moreover, what does it mean to shift our own outlook, not only on healthcare in the formal ways that we think about it, but our own health as individuals? The purpose of everything within this rotten system is not to care for health. If it was, we wouldn't be here in the first place. So let's not confuse this capitalist project as actually caring for the health and well-being of communities. If we take its reactionary attempts, like those measly 4 free rapid tests we all probably just ordered, as a gesture of care, we'll never be able to effectively confront the contradictions of the society and create something better. And so without a liberatory approach to health, we only perpetuate the root causes of inequity, contribute to a health system that continues to put profit over people, and further isolate ourselves from one another in a time when a united front is needed most. I think there are 2 main points that can get us thinking about how to answer the questions I posed. The first is that collective and united action will be able to create the conditions for change that we want to see and that we know is possible. Back in the Philippines, people are organizing community pantries, like you see in the top left picture, and advocating for the right for health, and food delivery programs happening right here in SF. If folks are local, connect with the Filipino community centers, because they're doing really awesome work to support our kababayan here locally through a food delivery program. Community members are stepping up and taking matters into their own hands, both here and in the Philippines, not only because of a lack of government accountability, as we know and we've witnessed, but they're also actively practicing community care. And last year, KHC launched a grassroots community health assessment with the support of young professionals and students who saw the necessity to investigate how COVID was impacting our local community. I won't go into this too much, but if you're interested in learning more, then definitely check out Jason's workshop later today on our community health assessment. And KHC also contributed to many grassroots campaigns in the past year, such as the Philippine Human Rights Act and NAFCON's Bayanihan response. So the examples that I just shared, they're all initiated on the same basis. People saw an issue and organized to address it, which leads me to my second point, which is that we need to learn to lean on the strength and collective or capacity of the collective. There are many actionable ways for those in the health sector to get involved in grassroots organizing, because there's room in the movement for everybody, whether you're protesting in the streets or donating to a fundraiser. These are all tangible ways to support community-led efforts. And NAFCON's Karapatan Kalusugan campaign, which makes the call for a free and comprehensive healthcare while also addressing the socioeconomic and political factors impacting health and livelihood, is just one way for folks like us to get involved. So I'm gonna pause so y'all can take a picture of the QR code here, and hopefully that works. Hope y'all took your pictures. So in capitalist countries like the US, as we're told many times over and over, individual hardship and merit is what gets us recognized. but many of us, oh, mute, thank you. But for many of us who came into a field like the health field, you know, we came into it because we have a passion for our community. A lot of us have our own personal experiences with health, or our loved ones have a personal experience with health, and you know, that's what brought us to the field. Sure, you know, a few of us can trailblaze to make way for others, but really, in order to make this work sustainable, we need to see ourselves in relation to the whole. In other words, we need to revolutionize the way that we see ourselves in relation to each other, and community health is really a part of that. So in a world that is constantly trying to tear us down, why would we do its bidding? When times get hard, we can't self-isolate. Unless we have COVID, then please do. We have to find the fire within ourselves and turn that into organized action. Find like-minded people, start or join an organization, partner with other pro-people organizations to broaden your reach. Really, the possibilities are endless because so many of us are fighting for a better future that, again, that we know is possible. And the reason why I never saw myself as a part of the field is because I don't have an end goal anymore. I realized that for me, getting these 3 letters behind my name or those credentials on a paper, all those things weren't important to me. They aren't important to me. The new public health challenges all our preconceived notions about what public health is. It isn't just about studying our community. We actually have to be in step with them, hear their struggles, and empower them to take action. People ask what I want to do with my life now that I've finished school, and and I don't want to, you know, continue on in our in a PhD program. And I say it's to organize and serve the people with every opportunity that I'm given every day. And that can be scary at times, not knowing, you know, what's next, or not having this kind of clear trajectory for myself anymore. But I'm grateful for the support of my community to guide me along the way. When I was in the Philippines, grappling with the realities that were different from my own, I asked the folks that I met how they continue to do this work every day, and they said that they just continue to smile amidst the struggle. A lot of what I share today are just lessons that I've garnered in my lifetime and through the work that I do. And in the face of continuous and constant loss, I choose every day to serve the people wholeheartedly because I know that fighting alongside each other for a just future will always outweigh the struggle. So, to end my keynote for today, I want to pull the last few sentences from the book that I mentioned earlier, A New Outlook on Health by James Boggs. It's actually a pamphlet that was released in the 70s, and the book from Foreign Language Press, they actually included an introduction specific to the COVID-19 pandemic. So again, highly recommend. And this is the quote. In the struggle to take care of our bodies in a new, more human way, we can discover a new humanity in ourselves, a humanity which will manifest itself not only in the good health of the individual, but in healthier relations among us all in the communities where we live and the places where we work. And I think this quote really captures the essence of what I'm trying to say, that public health is public health, it's community health. It needs to be embedded in the actual conditions of the community. And when we see that and we challenge the ways that we already think of public health and the assumptions, we're actively contributing to creating a better society. And that's the end of my keynote. Thank you all again for the time and space to share my personal journey with you all. if you're interested in learning more about KHC or would like to join the next medical mission with NAFCON, when we're able to, of course, with the pandemic, feel free to hit me up at my email there. Follow our Instagram, Couple of Health SF, and we also have a Facebook. And please feel free to ask any questions. Thank you.
Wow, that was really amazing. Thank you so much. Honestly, right now I'm having so many goosebumps, so many chills. I think a lot of people definitely are experiencing this at the same time, just because of your time commitment and most important, your passion, just to persevere through our community is just amazing. It's inspiring. So yes, if you do have any questions, please definitely put this down in the chat. Other than that, I think I do have one question for you. Like, you go on explaining on sharing people's story and continuing on sharing people's story. Can you elaborate more on why that is so important?
Yeah, no, I think that's a really good question. I think for many of us who are academics or, you know, kind of go through the whole school, right? We're so used to just being in our heads about things, theorizing about things, or thinking really hard about things. And kind of like what I said in my speech, thinking about things, getting in our own heads about things, it really doesn't help anyone. We can think as much as we want to, but there's no, you know, tangible action that will come from that if we're just thinking about it. And so I think being able to carry on the stories of people that we know or we meet, not only, you know, in something like a medical mission, but even just our own family stories of migration or hardship, those kinds of things. You know, those are the things that we should carry with us, especially in the work that we do, and especially if we're in a health field, because we're not just doing it right for the pay or the, you know, the gratification or whatever it is. Yeah,
I definitely agree. Yeah, because I wanted to elaborate on like sharing the stories, because that's how we get people's emotions tied together. That's how we ensure that like other people are feeling the same type of way. Just moving forward, I see people asking about your thesis. Is there a possible chance of where we could find your thesis?
yeah, I have it saved on my computer. I can I can share it with Jen or whoever it is, and if y'all want to share that out to folks, you're more than welcome to do that. Yeah,
Great, because just hearing how you chose not in like outside type of like box thesis because you were comparing to other people's thesis, like, you know, food insecurities, mental health, but something that you are very passionate about. I think that's why we want to read it. It's why we want to, you know, dissect it a lot more. And I see that we do have another question here. This question is from Jasmine. Jasmine has says, what are some sustainable healthcare solutions that you think what are some sustainable healthcare solutions that you have been seeing in communities? Definitely put that down in the chat one more time.
I'm just scrolling through everybody's comments. Thank you all. Let me scroll down to the very bottom. Sustainable healthcare solutions that I'm currently seeing in communities. Yeah, I think it's hard to kind of pinpoint. Well, I guess let me preface by saying like the conditions here in the US are really different from the conditions in the Philippines, right? They kind of have their own set of issues and problems. But in terms of sustainable healthcare solutions that I'm seeing in communities, I think really, I honestly think, you know, organizations like PAWIS or NAFCON who are actually taking the time and space to educate people, to learn about, right, like the things that they experience in the day-to-day, I think that in itself is a sustainable healthcare solution, because you're not just, again, like swooping in to provide these services for people. Though, right, like that's not to dismiss the services that organizations like nonprofits provide, because they actually support people in their day-to-day lives, right? So it's not like it's a like one or the other. I think that it's just both need to work in tandem, so that after the services, right, people aren't just like going back to their lives, but you're actually doing like what I was talking about, and kind of what I talked about in my thesis is the constant like politicization and like raising of their consciousness. So yeah, folks truly understand their conditions and feel empowered to like actually change them. I think that is in itself a healthcare solution. Like, I think if we start there, like, and not just with like, you know, trying to organize people, but I think in general, like when we start with consistent and really critical like education, I think that's going to be able to build up sustainable like people power.
Yeah, thank you for that. I definitely agree upon that as well too. Like how you said in the beginning, like, or not in the beginning, in the middle, like theory and practice. That's how you bring consistencies and ensuring that not only progress is happening, but action is happening through all levels of field in the government. So yes, thank you so much. All right. So let's give a round of applause, another round of applause for Kamille one more time, everyone. So yes,